Hi, everyone. Thank you so much for joining our on-demand webinar. We're going to give everybody a minute or two to join, and then we will get started. Looks like we have 19 people with us so far. We're going to give it just another minute, and then we will begin our conversation. I'm going to give it about 20 more seconds, and then we can start. Thank you guys for joining so promptly. We'll begin in just a little bit. Okay. Hopefully we have some other people joining us, but in the meantime, let's go ahead and get the conversation started. So everyone, thank you so much for joining us today. I'm Amber, the Director of Strategy and Business Development here at Examinetics, and I'll be your host for today's webinar. Today, we're focused on a common topic that many clients face, on-demand occupational health solutions. We will be discussing our new solutions that allow customers to perform testing based upon when and where it is needed. We're going to cover how Examinetics is helping clients like you address the most common occupational health challenges with flexible, fast, and cost-effective services. We're also joined by Mike Pells and Matt Kafer.
Good afternoon, everybody. My name is Mike Pells. I am the Vice President of Health and Safety Solutions. I have about 30 years of experience in the occupational health and safety industry segments, starting out with my first 10 years working in the automotive industry on the safety side of things, managing companies' work-related injuries and medical compliance programs.
I'm Matt Kafer, Director of Technology and Development at Examinetics. I've got about 15 years in the mobile, medical, and dental space, including occupational health. Started out in the operations side of the house, but over the last several years, I've transitioned over to technology. So looking forward to having a conversation with you all about our on-demand offerings.
Great. Thanks for both of you for your time and for joining us for this conversation. For the participants who are on the line, there is a chat available. We will be monitoring that at the end of the conversation and answer any questions that we have time for. So please feel free to ask your questions throughout the conversation, and we'll address them at the end.
Cool. So I think maybe just to set the table about what we're going to talk about today and who the audience is who might be interested in this. Just kind of give you an idea of how these on-demand services sort of came about for Examinetics. Traditionally we were really a mobile services vendor. Over the last several years, kind of two things happened in parallel. One was we started looking at some technologies to replace some of our aging equipment in our fleet. And then alongside that, we started getting requests, sort of, something would be mentioned in a touch base with a client engagement person. We started hearing things from clients from a lot of different departments about, hey, we've got this pain point, or there's just, maybe it's not an incredible pain point, but there's some friction in the process here. And what was really interesting is we started hearing that from a lot of different departments within these companies. So not only were we hearing it from, the safety managers or the occupational health folks there, but, we were hearing from HR about challenges they'd have with onboarding or talent acquisition. We'd hear from risk management about, can we help getting some of their policies in order? And we hear a lot from operations. I mean, they're pretty heavily impacted by a lot of these activities that we do chasing compliance. Um, and it was just really about how they enjoyed the efficiency of the mobile platform, but there were just some other modalities that kind of left them hanging. So we started hearing from them about, is there something that we can do to help? Right at the same time, we were looking into some of these technology platforms. And so that really started us down the road of looking at how can we provide some of these services and that we've already offering as well as new services, just in a little bit more flexible or cost-effective sort of delivery method. So that's how it all started. I mentioned a lot of different departments in that. Mike, maybe just to start things off, there's a lot of moving parts to occupational health. It's pretty challenging, especially when it comes to timing and logistics. Can you talk us through, sort of why that is and what some of the challenges are that our clients are facing?
Yes, thanks, Matt. I think when you look at it, the initial three that we always look at is there's an inherent amount of unpredictability that goes into this industry segment. Whether it be something on the front end where it might be a work-related injury, companies cannot predict when and where an injury happens. A lot of our clients historically are working, off hours, weekends. They may be doing project-based work, and when an injury happens, it's never at the right time, or if there ever is a right time for an injury. But the idea is that unpredictability from that side of things makes it very difficult for a company to respond quickly and appropriately on behalf of their employees. In addition to that, there are a lot of different factors that go into the regulatory compliance side of things. You may be an employer that does work and all of a sudden a project comes about and it's on a stat basis and you need to get people to be meeting the regulatory compliance standards. This location may be very remote. There might be other factors that come into play, and you want to respond and respond quickly, because every day that goes by that you haven't been able to respond and get people on the job site is lost revenue. So a big part of that is handling that unpredictability. The other part that comes into play is when you look at a lot of the traditional models, whether it be, our mobile unit fleet that is out there in the field, or even utilizing, our clinic network. Now you are bound by the time element, whether it be the availability of a mobile unit to respond in a timely fashion, or just even clinic availability. We've seen that from COVID moving forward, that the availability to get employees in and out of clinic on a timely basis isn't what it once was. So those type of models don't always fit what employers need. And then the last part of it is, a lot of companies are working in very remote locations across the country, whether it be the US, Mexico, Canada, Dominican, Puerto Rico. They may be in a location where the nearest clinic that can provide services could be 100 miles away. And if you have a work-related injury, it's delaying treatment. If you need medical regulatory compliance standards met, you could be losing a half day to a full day just to get those services met. And that really negatively impacts a business.
Yeah, I mean, with so many locations and kind of the remoteness of some work sites, I imagine that could make things pretty complex.
It really does. And, part of it is that also being able to assist our clients, because they have to meet certain regulatory standards, whether it be OSHA, MSHA, FRA, and making sure that these capabilities and those standards are met. And that's one thing that we've been able to inherently build into our on-demand platform, is meeting those requirements. And then even from the standpoint of another area that our clients really came to us with, is the fact that being able to get new employees onboarded in a timely fashion. If you make an offer to an employee or a candidate and everything is set up properly and you have everything in place, and all of a sudden now the OcMed clinic you're relying on says, okay, our next available appointment is 5 days from now to get them in, this is delaying that process. And what we've been able to do within the on demand is make these services available real time, onboard employees in a fashion that is more suitable, which means that they're losing a lot less candidates throughout that process. And we feel like that's kind of tied this all together. So you kind of have that win-win situation, not only on the front end, but also on the back end support.
Yeah, it sounds like staying compliant can be pretty challenging to do. So I'm curious, Matt, what do we mean when we say on demand?
Yeah, that's a good question. Look, I'd like to say that we coined the phrase, but I'm certain that we didn't. The analogy I like to draw is to on-demand television viewing, right? It's not a pitch for television, but it's what you want to watch when you want to watch it, and you don't need to wait for it to come on and record it and all that sort of thing. So what does that mean from a services perspective? It's really about getting the services that you need when you need them, and being able to use them in a more flexible manner, right? A lot of these services are self-administered services that if they require equipment, we can ship to you in as little as a day or two. You can have it for as long as you want it, within reason, of course. There's flexibility in whether you keep it for a couple of weeks or if you keep it on site all year round. And really what the aim of this is to give you the convenience of on-site testing, which is really reduction and disruption to your employees, right? One of the big downsides of sending people off-site to a clinic is that fact that they're going off site, right? There's a time away from work, there's risk involved in sending them across town. People love about the mobile units is all you have to do is walk across the parking lot. In the case of on demand, probably don't even have to walk across the parking lot. You just walk to your office or to a conference room, wherever you're administering this stuff. So that's the convenience aspect. And then from a flexibility point, and look, we'll drive this home. I think you'll all be tired of hearing the word flexibility, but it really is at the core of the on-demand offering, is being able to get the service you need sort of when you want it, where you want it. You don't have to have any wait times to schedule a mobile unit to come out. So really think about convenience and flexibility there.
Well, you've mentioned our mobile units, which I'm sure a lot of people know Examinetics for our mobile units out in the field. How does this on-demand hearing program interact with our traditional mobile unit testing?
Yeah, it's really built to be a complement to it. In some cases you can choose to use either or, but a lot of our clients are actually using both. Take the example of I don't know that there's ever been a client site, no matter how well run, that the mobile unit comes on site and every single person that needed to be tested that day is there, that there was nobody on leave of absence, nobody that had something urgent they had to do for their job. So you always end up with some sort of handful of people that still need testing after the mobile unit has left. And these on-demand services are a great way to take care of that. We'll talk about some other alternatives later. But I think really the big thing there is it's a good complement, or if you do choose it, use it as a standalone, it's often more cost effective depending on how many people you have at your facility. And then I think the big umbrella, like I'm a technology person, so I kind of like to hit on this stuff, is the data management. So whether you have people tested using an on-demand solution or people tested using our mobile unit, all that data is coming to the same place. It rolls up into the same reports portal. So you can look at your, any of your reports that show who's been tested and see all that data all together at one point.
Yeah, that makes sense. I think, you said it yourself. I think people are going to hear a lot about flexibility, speed, lower cost. I'm curious, Mike, from your experience, what are some of the top reasons that you've seen clients choosing on-demand services today?
Yeah, and I think Matt did a really good job of touching base on some of the cores, and I've always kind of broken it out into the top 5 areas that I feel like this really approaches from a solution standpoint. Speed is obviously one of the top ones that we always look at. Again, not waiting for a mobile unit to come on site, not waiting to be able to schedule to the clinic, not only being able to test in real time, but also because of the interface that Matt and his team have developed, it also provides results real time. And that's critical, whether we're talking about drug and alcohol or your respirator certification or your fit testing or your audio test. The idea is being able to get that information and being able to apply it is really critical. The second part of it is the productivity part of things. A lot of companies are very aware of what the productivity or operational time loss is associated with managing their medical compliance program. And again, you might be in a situation, perfect example is if you've ever operated around the Pittsburgh area, that occupational medical clinic might be only 5 minutes away or 5 miles away, but it takes 45 minutes to get there. So if you're taking an employee out of operational, which means they're no longer generating revenue, they're traveling 45 minutes to get to the clinic. Hopefully they're seen in a timely fashion at the clinic. And then it's another 45 minutes back. You're losing upwards of 2.5 to 3 hours of productivity. Where if you're using the on-demand solution, now you might be only losing that employee for 20 to 30 minutes. So when you start looking at what that does from a productivity standpoint, it's critical, especially when we're talking about remote sites. And I think that's one avenue that we've really seen a lot of companies really gravitate to is we do a lot of work in the pipeline industry. And we just got done setting up a project for one of our clients. And it was probably at least a 2.5 hour drive to the nearest occupational medical clinic. But we were able to solve everything they needed between the baseline audio, saliva, drug, and alcohol, even what we'll discuss later with physical ability testing at this remote site. And we limited the loss of productivity and just the convenience, because that's a big part of this is we want it to be a convenience. And as Matt said, flexibility is always a key aspect. A lot of our clients are working multiple shifts. And if you're relying on a clinic-based solution for your testing, if you have employees who are working second or third shift, that means you're having to pay them during their off time to go into the clinic to get testing done. Or you may have a situation where all of a sudden you were planning on using a 3M half mask because of the exposure, but all of a sudden your benzene monitors go off and you have to use a full face mask and supplied air. Well, you need to get fit tested for that mask. If you have the equipment readily available, you are able to respond to that on a stat basis, which changes how you operate. And when you look at all of these things in conjunction between speed, productivity, being able to service remote sites and that flexibility, you can start seeing from a cost-effective scenario how it really comes together as part of a complete solution that our clients can take advantage of.
Yeah, I like the 5 pillar approach that you have there with the speed, productivity, geography, cost effective, and flexibility. I think that's, a really great way of thinking about our on-demand services. Can you talk about the services that our clients are utilizing right now with Examinetics?
Yes, definitely one of the ones that is the most utilized is the tele-triage aspect of our injury management program. The tele-triage program is a physician-based program that is there available 24 hours a day, 7 days a week, so that employees and their supervisors can call in whenever there's an incident or an injury. Once they call into that number, our clinical staff is doing an evaluation to determine what is the severity of the injury, the type of injury, and so forth. But based off of the information, we are then able to develop a plan of care, which allows us to completely treat an injury remote without the need for them to go into a clinic setting. And we've been successful 60+% of the time on the injury calls that we have, being able to maintain those under the tele-triage program, which has a huge benefit to our clients. Again, not only because of the fact that they may be working anywhere in the country and now you have a consistent approach on how it's being handled, but a lot of these cases are in a situation where we may not even have a lot of the different aspects available to them, meaning that we have the ability to do translation over 200 languages so we can speak to the employee in their native language, just really lead to that experience that the employees truly feel like they're getting the best possible treatment.
Wow, I mean, 200 languages, that's pretty impressive, and it sounds like a pretty robust program. What are the benefits that our clients are seeing?
So if you really look at the benefits of the teletriage, when you look at keeping 60+% under that program, the first thing is it has a significant impact on reducing OSHA recordable or MSHA recordable events. Main reason being is all of the treatment we provide through the tele-triage falls under the first aid umbrella. So because of that, it's not negatively impacting your experience modification rate, especially because these are incidents that you don't have to report a claim to your insurance carrier. Those would be direct between the employer and Examinetics. And because of that, now you have a reduction in your frequency of reporting, which again reduces your mod rate, which will positively impact your insurance premiums. If you then look at just the cost structure, based off of a lot of the statistics we've gotten from the National Safety Council, OSHA, the Occupational Disability Guidelines, the average cost for the typical type of injury we can treat under tele-triage in a clinic setting is right around $3,200. Our program is treating those completely under the tele-triage anywhere between $850 and $1,100. So not only are you getting the benefit of not filing the claims and negatively impacting your insurance premiums, you're also saving direct dollars in the actual treatment of these costs. And then the third one, which I think is really a key indicator, is just the employee satisfaction. The employees don't feel like they are just being pushed through an assembly line. They are getting personalized care, and that care is available 24/7, not only if we initiate it to them with all of our follow-ups that we do every 24 to 48 hours, but once they're enrolled in the tele-triage program, that employee has the ability to reach out to us at any time of the day, any day of the week, if they should have questions about their care, if they have any questions about their conditions. And just giving them that personalized touch leads to a much higher employee satisfaction, which means they're more compliant, they adhere, and it's just a much better overall result from that process.
Yeah, I mean, I think the money savings on it per injury also just, yeah, I think that's a huge benefit for sure. The other thing I always think about with teletriage is, reasonable suspicion drug testing. Is that something that we can support with on demand?
Yes, if you look at our saliva drug and alcohol program, to be honest with you, we originally developed it very specifically for probable cause and post-accident for our client companies. The main reason being is if somebody gets hurt at midnight on a Saturday, the amount of available clinics to perform those services are very few and far between. And if you look at the cost associated with a mobile service to come on site and with something that we do offer, the costs are pretty exorbitant. I mean, they could be anywhere between $400 and $700. So if you look at the way our saliva program is set up, it includes an instant test, which also includes a lab-based confirmation. And with that program, the nice thing is the technology built into it. It's not even your employees that are reading the results. It is actually an app on a cell phone. It makes a big difference. So you've got the situation where you have instant flexibility to test right now. You have the lab confirmation available instantly as far as if it's a straight negative. You don't have to have your employees go off site or wait for an on-site collector, which can take up to 3 hours. And it doesn't matter where in the country they're located, you can have everybody apply to the exact same protocols, procedures, and testing modules anywhere in the country.
Yeah, I imagine that compliance is a big piece of this. Can you speak to a little bit about that?
Yes, and a big part of it is that everything we do follows very set regulations. If you look at our confirmation labs, they meet with all the same requirements as SAMHSA approved labs from that standpoint. Our technology platform that not only reads the results of the instant test cup to determine if it needs confirmation testing, is also the platform where you do all your documentation for your chain of custodies. So what's really nice about that is there's no paper chain of custodies. Everything is signed off on the app. Even the confirmation from the employee who's being tested that everything was done in accordance with the instructions on the app. So it makes a big difference. Our testing platform also is compliant in 49 of the 50 states. The only state that's still not allowing saliva as part of an on-site program is Vermont. Otherwise, our program is completely compliant in all 50 of the other 49 states. not only for probable cause and post-accident, but because our program comes in multiple testing panels, we have panels with and without THC, which even allows our clients to use it for pre-employment for new hires, randoms, because we can also test per the state regulations. And when you put all of those together, you can start seeing how this can be a very effective way to approach your drug and alcohol program, really for any of the different scenarios you may apply it to within your company.
Got it. Yeah, that's really helpful. Thanks for explaining the tele-triage offerings we have right now. Matt, I'm curious, what about for the hearing side of the business?
Yeah, the on-demand service we have for hearing is Salix on demand. Put really simply, it's a self-administered hearing test system that's really tablet based. A little bit of the backstory to it. This was really the technology that we were looking into that I mentioned at the top of the hour. Looking to replace audiometers in our aging fleet of audiometers. And really hearing from the customers about some of the needs that they had with audiometric testing. So we ended up developing this platform 100% internally. We developed all of the hardware and the software in the system. And it was a pretty lengthy endeavor, but we had a lot of good feedback from customers really driving some of those initial design decisions. The sort of the thesis that I had, or maybe the guiding tenet that I had was we developed this is I really wanted to make occupational health hearing testing accessible to anybody, regardless of how much experience they had with it in the past, right? Anybody that has any experience with it now knows it can be a little bit daunting to get into, right? You've got equipment you have to buy and maintain. You've got to get that equipment calibrated every year. There's the issue of the testing space, prior to some of this newer technology coming out that meant you needed to have a sound room. So there's a lot of moving parts. The sort of the learning curve on it is pretty sharp. But since we were going with a tablet-based platform, we said, look, can we just make an app that is incredibly simple to follow, that if you go through the steps in the app, you're guaranteed to come out with a compliant hearing test. So that's really what sort of guided a lot of our design decisions. And so putting all that together, we wanted to cover the same points of your hearing conservation program as we do in our mobile unit. So that's making sure that people are trained to the OSHA or MSHA requirements on the effects of, occupational health occupational noise exposure, how to wear hearing protection, how testing works, that sort of thing. So the training component, of course, the test, whether it be a baseline or annual or a retest. And then notification in case that there has been a significant change in their hearing. So our on-demand solution covers all three of those points. I think really this is, when you put it together with some of our other modalities, it's meant to be the most complete testing method, right, of how you can get all of your employees tested. So a lot of cases, it's more cost effective than bringing a mobile unit on site. There's sort of that inflection point if you have maybe 50 or less employees where it's more cost effective to use the on-demand solution. There are always trade-offs, right? If you're doing it on demand, then you have to sort of see how you administer it throughout the year. But again, that sort of gives you the flexibility of, instead of having to pull everyone out of production on one day, maybe you're testing people on their anniversary dates or some other schedule, right? So a couple other points about that solution. And really this is sort of the stuff, again, being in the technology side, I kind of get excited about. Using a tablet-based solution, making it a technology-enabled product gives us a lot of options that you just don't get with your traditional audiometers, right? This is the only audiometer solution that has training built in. So if your people go through it, their training has been done and the record keeping associated with it. Right now we have 23 languages available on the platform. like if anybody's done any large amount of hearing testing, I think you'd agree. The most important thing you can do to make sure you get an accurate hearing test is to make sure that the participant knows what they're supposed to do. I saw this from testing on our mobile units, and I think, most of our technicians and audiologists agree with that. With 23 languages on the platform, we're able to give the participant instructions in the language they're most comfortable with. And this isn't just text. One of the things that we've seen is we need to address some literacy barriers as well. So once the people have their headphones on, pretty much any instruction that we give them, not only is it text on the screen, but we have voice actors translating the application so they can hear in whatever language they chose. So 23 languages. We also have some telehealth or teletechnician capability built in. If you're regulated by OSHA and you're in certain locales like Washington and Oregon, or, for all of MSHA, there's requirements that the person administering the hearing test needs to be KAOC certified. So all of our technicians are for our mobile units, not an issue there, right? But if you are in one of those locales or governed by one of those regulatory agencies, you can use our telehealth feature. Essentially, it's a picture-in-picture video chat with a KAOC certified technician that's right there on the tablet, and they can walk them through the test. We've also seen some customers kind of pick this up if they're somewhat concerned about their employees being less technology savvy. The teletech can actually see the screen of the tablet and help them if they have any problems. And I think the last part about the platform I'll hit on is relatively new. Aside from this Salix On Demand platform, we've launched a new website for capturing forms. And one of the first things that we've implemented on there is the work relatedness evaluation. We've integrated that with the Salix On Demand tablet. So if you have someone take a hearing test, it's a retest for them, and they're a confirmed recordable shift, then they can actually fill out that work relatedness evaluation right then and there on the tablet. Gets captured digitally, sent to the audiologist. You don't have to get them back, have them fill out a paper form. And again, it's 23 plus languages. So hopefully it reduces some friction there. I think just to sort of cap it off, hopefully this sounds pretty interesting to people, especially those that are already using our mobile units. I mentioned it earlier, but the data part of it, I think, is really, really impactful, right? So with Salix On Demand, you're getting instant results. So person takes a hearing test. If they need to be notified of a change in hearing, they're notified right away. Either way, they get a walkthrough sort of explaining their notification graph and how to interpret their results. I mentioned the built-in training, but then again, all of this data is rolling up under the XM platform and is together with all your other data, whether it be on-site, near site, or on demand. And that's available as soon as the test is done.
Wow, it sounds like the Salix On Demand offering is pretty robust. One thing I'm also hearing from clients is questions about our respiratory on demand program. Can you speak to that?
Yeah, sure. I'd kind of break the respiratory compliance program into two buckets. I think the first part is the online clearances. So, of course, before you can wear a respirator mask for your job, you need to be medically cleared to wear it. We've been doing this for quite a while, but I mentioned the website we launched earlier, Inform. We've actually upgraded that online clearance platform recently. So people can fill out a medical clearance online. It takes about 15 or 20 minutes. It's a self-service website, so you've got 24/7 access, kind of back to what we keep mentioning, the flexibility piece, right? Once you're onboarded onto the platform, if somebody needs a form, you can send it to their email address or text it to a cell phone number. They can fill it out at any time of the day. And you get immediate results from it as well. A very high percentage of folks that need a clearance, we can clear right away, middle of the night, doesn't matter. So we think that really gives you a pretty user-friendly way to get your clearances done. You can also track completion, right? So if you've sent out clearances to 20 people, you can see who's hasn't started it, who's not finished it, who's done. If anybody needs to call our nursing staff to discuss their clearance, you'll see that as well. And then the second part of it is the actual fit testing, right? So we really excited to launch a quantitative fit testing equipment rental model. A lot of words there, but it's do it yourself with our support. Really, there's a couple of pieces to this, and we'll talk about some of the drivers of it maybe a little bit later. But long story short, we've seen a really increasing demand of people asking if we can help with fit testing. We absolutely could in our mobile unit all the time. What if you have 3 or 4 people, or you sort of have a need on a project-based work where you have this need throughout the year? So we can ship you a kit now to perform quantitative fit testing. Some of the good things about it are, of course, flexibility. I'd be remiss if I didn't mention that. But there's this issue of making sure that you have the right masks and the right adapters. I think OSHA requires that you at least offer 2 different masks for any one role. If you're sending somebody to an Occ Health clinic, how many masks does that mean you're sending with them? So there's 2 different masks. Maybe they're a medium, maybe they're a large, right? So now you've got somebody going across town with 4 masks. And then maybe one of those doesn't work out. They have to go back to the clinic, right? So you have all the masks that you offer. And if you're doing this testing in your office or in a conference room, it's pretty easy to just go grab one that works and get that taken care of. And then, this service, there's a little bit of an onboarding to it. You'll talk with some of the folks on our staff to make sure that you're getting the right masks for the right role, making sure you have the right adapters for it. And so we think those two really go hand in hand. We're seeing a big uptick in people interested in this, especially I think driven by, we're seeing a lot of Occ Health clinics that have discontinued their quantitative fit testing services. So might have been available last year, but they're just not providing it anymore. And so having a quick ship rental option is a great thing for a lot of our clients.
Yeah, absolutely. I think, both the hearing and the respite are great on-demand solutions that give a lot of flexibility to the clients. I'm curious, what else is on the horizon that we might have not talked about yet?
Well, one of our newest programs that we've gotten implemented is an aspect of our ergonomics program, which is physical ability testing. We've seen a much larger percentage of companies incorporating physical ability testing as part of their new hire process because their positions have physical requirements. And the problem with a traditional physical is not going to give you an idea of can a candidate physically perform the essential functions of the job accordingly. And typically, most of these physical ability tests have been performed at our occupational medical clinics in our network. But we're finding that because of either just the volume of testing that needs to be required, or once again, hiring needs in remote locations, those clinics aren't always available. And we were able to use a lot of the same technology platform that Matt and his team have developed for Salix and the on-demand fit testing, and now apply it to the physical ability testing. And the nice thing is that we are very fortunate. We do have a certified ergonomist on staff that makes sure that every single program that we develop as it's being performed through the on-demand platform meets all the ADA and EEOC requirements. It can be performed completely on site. So everything you need to perform these on-demand physical ability testings on site will be sent to you. So it'll have the tablets, which will actually be monitoring the exam. It'll have any of the supplies that needed, like a lift test box, pulley systems, everything. So you can actually provide these testing parameters right at your job site, and it becomes a very cost-effective solution. And if you look at a lot of the statistics, the reasons a lot more companies are incorporating the physical ability testing into their platform is because of how it positively impacts injury prevention. I look at loss run data on a regular basis, and it always amazes me how many injuries are sustained to a new employee who's been on the job for less than 90 days. And typically that it means they do not necessarily have the physical ability to perform that job. These physical ability tests, and now that we've created a second delivery method to offer them, I think is going to be a real good solution for a lot of our clients moving forward.
Wow, that's fantastic. Yeah, I think that's going to, a certified or ergonomist is definitely a great asset to have on staff. So we've talked a lot about the different services that we offer. Can we chat about the biggest benefits that our clients are seeing from each of these on-demand services?
Well, on my side of things, and I touched on it a little bit earlier, one of them definitely is dealing with a lot of the HR professionals, the benefits that are associated with the faster onboarding and the better candidate experience. That is something I hear on a regular basis, are those two aspects of it. And I'll give you an example of one of our clients that was struggling because it was taking them on average 7 days to onboard a new candidate into their process. Two problems they were having with that. One, they were losing candidates throughout the process because they were going somewhere else that they could get onboarded faster. The other part of it is it's a lack of revenue generation. When they bring in employees, it's with the purpose of generating revenue. And working with this client, we were able to incorporate not only their baseline audio through the Salix, but also the utilization of the saliva, drug, and alcohol program. And over the course of about 4 months, they went from an average onboarding time of 7 days down to 2 days. And it made a huge impact on their operations. And it allowed them to be more effective and bring on new business in a more timely basis because they knew they could get people into the pipeline that much faster. And it was just a better experience because when the employee would come in to sign their offer letter, they could get their hearing test done on the Salix, they could get their saliva drug test done, and guess what? They're ready to work. So the nice thing is it really made a positive impact, especially during that part of the onboarding aspect.
Yeah, that's awesome. Um, I'll talk about maybe a couple of the offerings with saliva. Again, the flexibility is really key. From a results perspective, it's kind of interesting. I think instant saliva kits are actually more accurate than urine tests. The DOT kind of debated this for a while. It's recently been approved, but it's not fully live yet. And I think the example I'll use is, clients using this for post-accident testing on really remote sites. You'll see that as a kind of common theme here. One client previously using a mobile provider for those stat needs. Think about it from the employee perspective. You've just had a workplace injury. It's the middle of the night, and you're going to sit in the conference room and wait for, I think it was 2 or 2.5 hours for the stat collector to show up, right? Whereas with the on-demand saliva kit, it's right away, as long as it takes me to go to my office and get it. We see, first of all, just a lot more satisfaction from the employee, but you also have a quicker turnaround of getting that incident resolved, right? If you are testing and it comes out as a negative, then you can immediately move on to the next step of the process of getting first aid, or getting that drawn to a close. So really, I think the great thing about the saliva that I've seen from several people is the quick turnaround time on getting it done. In terms of on-demand hearing and respirator fit testing, look, there's a lot of benefits that people are seeing from the on-demand hearing testing. I'll hone in on the cost effectiveness of it. If you've got 10 or 15 people at your location, it's really hard to beat the cost of doing this with an on-demand product, right? All the cost and logistics associated with rolling a mobile unit. And then you kind of have to factor in some of the indirect costs of lost productivity if you're sending people to a clinic. Sometimes that might not even be feasible. But Mike mentioned we do a lot of work in the pipeline industry. There's a lot of sites for a certain customer where, they were, having a mobile unit come out for a full day to test 10 or 15 people. Switching to on-demand really made sense for both of us in that case. And then on the respiratory testing side, I mentioned earlier the Occ Health clinics stopping their offerings of quantitative fit testing. So the example is a client that does project-based work. They have a work site that they stand up once a year or maybe every 2 years. It was a really nasty surprise when they went to spin up that work site and found out that the clinic that was close to them didn't offer quantitative fit testing anymore. Um, so, luckily being able to ship this sort of thing out within a couple of days, they're able to get it at their job site and get their fit testing done. Really big win for them and big win for us.
And I think to kind of put a closure on it, Amber, the other part of it is that I talked about the candidate experience on the front end. On the back end side of things, it is the tele-triage program. It not only provides a very valuable service to the injured employee to get them medical attention in a timely basis, but of all the things that we do, it probably can have the most significant return on investment for our clients. And I think that's the biggest thing. Not only are we looking at the lower cost per incident, the reduced of our OSHA recordables, again, the reduction of loss of productivity driving to and from, but it's just even the way we transparently provide these services with the employee to get their buy-in. And it's part of a culture change. And it's amazing throughout the years. It's not even when maybe a safety manager or an HR person from a company who leaves and goes somewhere else and they want to bring us with. If I had a dollar for every time it was an actual employee who utilized the services and believed in the services and went to work for a new employer and said, why don't we have this? To me, that really shows that we've been able to develop a program that creates that good balance between providing optimal service for the employee, but also protecting the interests of the clients. And I think that tele-triage fits that niche to a T.
Yeah, I mean, it sounds like there's a lot of great benefits for our on-demand services across the board. I'm curious, how do our on-demand options fit into the more holistic, bigger picture of all of Examinetics services?
Yeah, I can talk you all through that. I mentioned when we started that traditionally Examinetics was sort of a traditional mobile provider, right? We did annual screenings, a little bit of other services. But what we're really looking to do with all of these on-demand products and our other modalities is provide our clients more support across the whole employee life cycle, right? We're not just here for your annual compliance needs. We want to be able to help you with pre-employment, onboarding, post-offer screenings. We want to be able to help you with your industrial hygiene and other OC health needs. All the way through to injury management, following up on those injuries, and then sort of ending it with exit audiograms and other offboarding activities. And then I think one of the big values here is if we can provide all of those services across the whole employee life cycle, one is going to be the key sort of word here, right? You've got one portal that you go in to either manage some of those orders, to look at results, to get some sort of analytics data from. You've got one vendor that you work with for all of them. Having one point of contact for all those services is great. One vendor is also really exceptional if you have more than one site, right? If you're a national company, knowing that you have one point of contact from a corporate perspective, or any of those individual sites have one point of contact, that you're going to have the same quality of care and same procedures being executed across all of your sites. Really important. And so those on-demand features that we've been talking about, they kind of fit into our 3 delivery method model, right? So you've got on-site, mobile unit comes out, we can test a lot of people at once. You've got on-demand, which gives you flexibility for folks that either missed the mobile unit, or maybe you have a site where it just doesn't make sense to bring the mobile unit out there. And then we have our near-site offerings as well, where you can, through our platform, schedule people to get sent to a local clinic. And so really it's finding which combination of those services makes the most sense for your sites. A lot of times it's not an either or, it's an and. And then for some sites, one is the clear winner, right? So that way you can really mix and match all those different service offerings to meet your business needs. And then to me, the icing on the cake is, again, back to the data management. So you send some people to a clinic, you have a lot of people tested through the mobile unit, and some people get tested through on demand. You don't have to coalesce that paperwork. It's all in the portal for you. You can manage it all in one place. So look, it sounds a little cliche, but I think our goal with all of these things is to be the one platform, the one partner, the one protocol for you across your entire employee life cycle.
Thank you for kind of pulling that all together and helping us understand how the bigger Examinetics picture fits into the on-demand services. That's helpful. I guess is there anything that we haven't covered or that you want to make sure that we cover on on-demand services?
I think the one thing that, we've kind of alluded to it, but not in completeness, is that one of the aspects that I think we bring to this is the ability to develop the programs and help our clients understand the proper utilization of each of these the different delivery methods. And I think that's really important because, if you only have one service to offer, you are going to obviously tailor your approach specific to that offering. Seeing that we have three delivery methods and we have the ability to construct these programs very much customized to each one of our clients, our ability to assist our clients on analytics to find out, okay, it makes more sense to do mobile unit versus on demand versus clinic services. I think that gives a lot of security to our clients that we really are working in their best interest. In addition to that, I think we're also very fortunate. We've talked about the fact that we have the certified ergonomists, but we have our corporate medical directors who specialize in occupational medicine. We have safety specialists. We have certified industrial hygienists, all on staff. These are all employees of Examinetics who work in conjunction as a team on your behalf. And I think that's why at the end of the day, when a company comes to us with their explicit needs in order to be able to be an effective company on their part, they're going to get a solution that really is tailored to what they want to get in place.
Yeah, I'll tag on to that, Mike. I think I didn't mention it when we talked about the on-demand hearing testing, but you mentioned the staff of professionals, right? Something that Examinetics has been providing our clients for a long time is, we have audiologists on staff. We have nurses on staff that are occupational health nurses. You get the same backing of those medical professionals with our on-demand services, just like you do with our mobile platform. So if an audiologist needs to review a test that comes through on demand, not a problem. If you submit respirator clearances through the online portal that needs nurse review, same service there.
Yeah, I think that's a great thing to point out. So thank you both for sharing that. There are a couple questions that have come up in the Q&A chat, so maybe we transition over to answering some Q&A from our participants.
Yeah.
So first question, for injury management, what is the pricing structure?
So one of the things that was always our goal is to make this as cost effective as possible. So part of that is there are no monthly or annual retainer fees associated with it. It is all based off of a utilization platform. So, if a safety professional is doing a great job at a location and they don't have an injury for 6 years, it doesn't cost them a penny to have us on standby, which is very beneficial from an ROI standpoint. But everything we do is based off of time allocation and the work we're doing. And we feel like this not only provides very good transparency to our clients so they know how we're interacting not only with the injured employee, but clinics, them as our point of contact, even the insurance carriers. And we feel like doing it in that time interval standpoint where we break things down as little as 6-minute increments so our clients are only paying for what they get. It really does give them that good return on investment that I mentioned earlier when you look at the cost under a tele-triage versus traditional clinics. So that's been our model since day one. It's been very effective, and that is going to be how we continue to move forward with our clients.
That's great. Another common question that we get is, is there a minimum number of employees that are needed to make on-demand cost effective?
It's interesting you asked that question because this is where that program development side comes into play because there's so many different factors. It's not only how many employees at a specific site need to be tested, but what testing needs to be done. Where is the nearest facility or mobile unit that is available to them? And when we do the analytics on this, we break it down to everything, including things such as productivity loss by leaving the job site and so forth. So it's amazing where you may have as few as 3 or 4 people that can justify the on-demand platform, especially when you're looking at things like the saliva, drug, and alcohol and the injury management. But when you're looking at things such as the on-demand solutions with Salix for the audio and the quantitative fit testing, you start looking at these aspects of it and looking at everything in totality. And that's where even, getting Matt from a technology standpoint involved as far as communicating records and so forth, it really has to be evaluated on a per case basis, but that's part of the support you get through Examinetics is that evaluation.
That's helpful. Thank you for that. And I guess, let's ask one more question. How do you make sure the results from these on-demand tests are compliant and trackable for any audits that might occur?
Yeah, I can take that one. I'll take the back part of it first. So trackable for audits. Hopefully I didn't run into the ground the data integration point we were talking about on demand. So it's all available in the portal. We've recently implemented some changes there that let you kind of click a button pretty quickly and generate some compliance documents that give you things like your audiometer calibration records, as well as the audiograms for each of your employees. So you can either get the records for an audit self-service on the portal, or you can always call us with any sort of special needs and we can generate those reports for you. As far as being compliant, that's probably the most important part about the technology development. Doesn't matter how user-friendly it is if it's not giving you good, accurate, and compliant testing results. So there's a number of things at play there. For the first part of it, on the hearing testing platform, we had to do some independent testing to ensure that the audiometers complied with the standards that govern these pieces of equipment. And then secondly, all the guardrails that we've built into the application make sure that you're getting a compliant test. So making sure that the audiometer calibration is still good every day, making sure that you measure the ambient noise in the room before testing begins. If you don't complete those steps, or if, say, you measure the noise in the room and it's too loud, the application physically won't let you continue testing. So you can be confident that you're getting compliant results. And the same is true for some of the other offerings, right? Like the quantitative fit testing. The machine has a built-in calibration that it goes through every day. So if it's out of spec, you're just not going to be able to use it. Does that answer the question well enough?
Yeah, I think that was great. I think that was helpful to explain why all of our on-demand testing is compliant and, audit proof. It'll pass and, gives you the data that you need for audits. I know we're running up to the top of the hour, so I think those were some good questions from the group. Thank you guys again, both to our speakers, for joining us for this conversation and talking about our on-demand services today. For our participants and our guests, I think if there's one thing that you can really take away from this session, it's that you don't have to wait for on-demand solutions. They're speedy, flexible, very convenient, and cost-effective for you. They're really designed to work on your schedule at your site and kind of within your budget. So until next time, thank you guys so much for joining and being a part of the Examinetics partnership. Have a great day.
Thank you.
Thanks, everyone.